Well, now turning away from evidence to practice, evidence to policy, Don Nutbeam, who was public health guru and then became deputy provost or something of the university, has now left because he wasn't made the vice-chancellor. Well, that's not altogether fair, but he certainly wanted to be the vice-chancellor. But he was an advocate for youth health from the point of view of the public health issues that needed to be promoted. So he challenged us at a conference in Vancouver, a World Youth Health Congress in 1995, and says his health promotion is political inherently, and that we need to find better ways to be advocates. There are all sorts of ways to do it. Contributing to the development of a good, well-articulated policy isn't a bad way. Why is a policy important? Because it's a process. It's the creation of a set of principles of good management of a system, in our case, youth health care in general. Translate a vision into programs and actions that deliver outcomes. So this is jargon, but in fact, if it's not written as a goal of government, it doesn't get, investment isn't committed in it. So in other words, when the Minister goes live with our youth health policy next Friday at 2 p.m. in this very place, this very building, it will be important as a symbolic gesture and commitment. The policy-making process was, the architect of this process was Fiona in her role as manager of CAR. And all the ingredients, we think this is best practice in policy development. We presented a presentation on this process in many places, including recently in Iceland. I gave a talk based on Fiona's presentation that she gave at the Menzies Centre. But basically we were saying it's important to know what the literature says, and her own review of resilience building in at-risk youth was a very important background document because it put our attention very strongly into marginalised young people. Online youth participation was helpful. The consultation forum I'll mention, but there were special consultations. You were present at some of these, I think, Les, on the Health Priority Task Force. We did ask people's advice. Reference group was very helpful and very hard-working, and intersectoral consultation happened through Youth Health Council and other opportunities. This was the makeup of the Youth Health Policy Reference Group, which we chaired. The Department of Health was present, very active. 2 wonderful young people we're hoping could come and be part of the Youth Health Policy launch next week. But Tajira Francis and Samia, what's his surname? Kinga, sorry, both might be able to be present. They're incredibly intelligent and impressive young people. NAR was there, the Youth Health Council was represented, and the new chair of Adolescent Medicine was also present, Kate Steinbeck. The whole idea of having a consultation which was conducted in a very creative way, it's based on what's it called, an innovative model, appreciative inquiry model, thank you. We are doing this as a double act, even though you're in the audience. But 120 people, very nice cross-sectional input, very high energy and very right brain process. That day gave rise to 12 sparkling ideas, which have been massaged into to the policy. Very nice to have one of our many health ministers open the conference. We counted about 9 or 10 health ministers in a decade, so it's certainly a musical chair sort of job. But also the voice of youth was very strong. Here you can see some examples. Kylie Poglays, a brilliant young woman who's a survivor of cystic fibrosis, moved me almost to tears, but she spoke about her appreciation of the fact that we cared enough to give a day to talking about issues for young people. And here's our previous chief executive in very active conversation with a very provocative young woman. It was a very good day, very interesting day. The recommendation, which we would obviously make, it's a no-brainer, is that the local health network should have youth representatives to enable health services to be more youth-friendly. We need to walk the walk in everything we do and have young people present. So this is what the new policy looks like. That was the previous policy. It sort of gathered dust for a while. It seemed good at the time, and it gave rise to our centre, so that was positive. The new policy looks and sounds very good, if we say so ourselves. So what we are saying to Carmel Tebbit when we responded to the document was, please be mindful of what the policy says. You know, it's your policy, and it needs to inform and guide what happens in terms of creating and shaping youth health services in the future. So I won't dwell long because of the time, but I just wanted to say the vision has been articulated very broadly, and it's about creating a community in which young people's health and well-being is valued, supported and optimised. So that was the vision. There was a lot of discussion about the values underpinning the policy, and these were debated, but also young people contributed to these. But the notion of a holistic approach sits very comfortably with our sector. Young people need to be valued for themselves now in the present, not just as future productive adults. Strength-based approaches, social justice, philosophy and creativity on ideas, things which are familiar. I won't dwell here, you'll be able to read this and soon you'll have a copy in your hand if you can support our launch next week. But the three main goals, with the 12 sparkling ideas sitting under them as major objectives, are that young people are encouraged and supported to achieve their optimal health and well-being, ways in which that can happen. That they experience the health system as positive, respectful, supportive and empowering, and there are certainly ways to do that, but improving access to youth-friendly services was one of those 4 major objectives, and that's certainly going to be enshrined now in a government policy. Our responses to the needs of young people to achieve positive outcomes are organisationally effective. So in other words, we do need better coordinated and more integrated resources, and we certainly need to improve training and research. So those things came out of the various consultations. One of the things we undertook to do as a centre, it was part of our performance agreement, was to assist in the creation of a chair of adolescent medicine. It was funded by the Medical Foundation of the university with very, very major support from docs. 1.2 million came from community services, and New South Wales Health is contributing 2 research fellowships and a recurrent funding for research and development through the chair and the academic department. Won't focus more on that, but we see it as quite an exciting development because it can arrange research collaborations and bring an academic rigour into the field. And certainly there's an obligation to look at primary healthcare research as well. So here we go. Minister Tebbit will be sitting here with us, standing here with us, possibly at this very podium. I'm not sure where they're going to do this. But we found out only this week that it's being launched and it's going to be done, we're assuming, with some media interest in it. And we're looking for people to support this event. We have to negotiate who actually is going to be officially invited, but I'm going to assume that an audience is going to be welcome. The recommendation that we've also made to the Minister is that the mandate for health promotion and prevention, in line with what the nation wants for people, is not clear enough in these documents. It's also one of the weaknesses that we see. The focus is more on acute and chronic care, but how do we also have investment in these other issues? And Les did mention that he's going to come and be part of a broader consultation. This is going to be for people at every level of the healthcare system for young people. So we're inviting all our colleagues in hospital-based services throughout the state, and the youth health sector will be strongly represented. I don't know that there's ever been a line-up. The Director-General herself has agreed to come. We'll see if that actually happens. But with Deborah, Richard, Les White and Elizabeth fielding questions from our field, we need to have our act together and be pretty clear about what we're wanting them to say back to us about our areas of interest. And I just find this an amusing slide because we live in a very cyber world, and I've included our website, not for self-aggrandising purposes, but because we have enormous resources available to people through this, including all the relevant websites from around the world dealing with young people's health, policy development, etc. So, thank you.